Can you all hear me? On the
Yes,
line.
sir.
All right. That is some yeses, which sounds like the majority. Doing all right? Ready for time? We're going to wait? You tell me. All right, good afternoon from the Brazos County Health District. Thank you all for tuning in for a situational update and opportunity to answer some questions on this day, August 7th, 2020. So total number of cases to date, 4,024. Daily new cases at 27 over the past 24 hours, and total number recovered, 3,588. Active cases currently at 389. Brazos County has 18 residents currently hospitalized, 3 discharged over the past 24 hours. Hospital occupancy currently, total bed number 73%, ICU bed occupancy at 82%. The total number of deaths to date is at 47. Since we last talked, there have been 4 deaths. A female in her 60s who was previously hospitalized, a male in his 60s also hospitalized, a female in her 30s also hospitalized, and a gentleman in his 60s as well. The total number of tests to date, 32,388. Going over some talking points, some things that have come up as questions, really a lot of them around schools that we'll hit on today, some COVID-19 testing, and on to questions. So regarding the schools, the last time we talked there was some confusion about who would be making the determination about when schools would be opening. The Attorney General and the Governor's Office made that clear that that decision-making authority lies within the school boards, and as I think appropriate, and will be then, of course, advised by the health district, as we have been in constant collaboration for weeks. We remain in collaboration, as mentioned, with the superintendents, also with school nurses, and with teachers, principals, those interested through those channels, to ensure that we have plans, protocols in place, and questions, lots of questions, of course, about opening schools and how will this look. And so we've been working all of that out, and in a collaborative manner. I'll mention also with the private schools in town as well. Questions about face masks. Those for our public schools have been pre-K through 12th. There have been questions about what are risk factors for elementary schools versus high school students. There's data out there from I might have mentioned this in our last press conference, but that looked at, especially those younger than 10, actually have less risk than we had originally had thought with respect to transmitting in the community. Older high school students are probably getting up closer to that 18 to 24-year-old age range, which we know. When we saw our surge even 4 to 6 weeks ago with respect to the ability for that demographic to transmit the virus. And so we think that high school students are going to be closer to that. So we have a lot to monitor moving forward, and that's the interest in the collaboration that we outlined. As far as some questions about how will school hallways that could be crowded, how will we mitigate that risk? Lots of discussion, planning in that regard. One-way trafficking to even block sections, interestingly, where students will be put and the teachers will be rotating. And of course, everyone wearing masks. And so the effort here to, within what is possible in the schools and the infrastructure that's there, to distance the best that we can and to avoid crowded situations. And a question, of course, with Texas A&M and with Blinn returning, yeah, no doubt about it, that is going to be the case. As Texas A&M and Blinn students return and have been returning over the past week, and as their classes will be starting around the same time that our public schools will, that we do expect more cases. And we have been working on that for months. How are we going to respond in the the boxing it in concept that we've discussed many times in these press conferences, and getting the infrastructure in place to make sure that we're addressing that inevitability of more cases ahead. Again, this comes down to protecting our vulnerable, to maintaining our hospital occupancy, and to preventing deaths. That's what remains our focus moving forward. Free COVID-19 testing, August 10th, 11th, and 12th at the Brazos County Expo Center will be available. That is testing by appointment only. That appointment can be made at on our website is the link, but it's texascovidtest.org, txcovidtest.org, or calling that number 512-883-2400 to set up those appointments. That registration opens 24 hours prior to the testing date. Testing is available for anyone above age 5, symptomatic or asymptomatic. Some comment about increase in Hispanic cases. We continue to have an increase in cases. I would say it's the proportion has been relatively constant, but higher. We have more cases represented from the Hispanic community than we do have Hispanics in the community. So we know that it's hitting the Hispanic community more than other demographics. And so essential workers that have continued to work through the pandemic, and there's just a lot of variables there, and so remain with the message that we've been talking about with respect to masks and social distancing, and how important that is. And so we will continue those efforts. So, all right, already on to our question section, and in fairness, if we could limit to 2 questions, we'll go through and just give me your top 2. And if you have more questions, I'll pick the top 2. But we're trying to keep it fair for all of our media partners to just no more than two questions on each one of these, please. And let's start off with the Eagle.
Hi, Dr. Sullivan. This is Chelsea Katz.
Yeah, hey, Chelsea.
Hey there. Thank you for answering some questions. And so my top 2 are, can you speak to the safety of face shields, especially in extended situations such as for teachers and jurors in criminal cases? Should they be worn with face masks? Can they be worn in place of face masks? And then also, as students return to classrooms, both at the K-12 and post-secondary campuses, what are the different thresholds that could potentially prompt a closure or and a move to remote learning?
All right, thank you, Chelsea. So 2 good questions. One, the first is with face shields. So the concept with a face shield is that we've seen these, they almost look like a visor that we put on, and then down comes a plastic piece. And that's better than nothing, all right? But we have to remember that what we're doing with a face mask is as much to protect our environment. And so we know that when we are affected with the virus, even before we become symptomatic, that we can be shedding the virus. So this could be from coughing or sneezing. It could be from spitting, from singing, from yelling, from shouting. And so we think about a face mask, and is that helping? I mean, maybe it's helping, but it's still the ability to aerosolize underneath the face mask. So that's why there's still the recommendation that we wear a face mask which is closer to the nose and the mouth, that would be intercepting those aerosols. And so really, ideally, both would be worn, but the face mask is preferred. Now, in situations, and we're mentioning our collaboration with nursing, I should also mention our athletic trainers as well, and talking about, how are we going to do this, and moving forward with respect to sports. And where we're outside, there is less of a risk. We know that because of the ambient air and the decreased aerosolization for that reason. And so some will be wearing that when they're outdoors as opposed to the face mask. And again, better than nothing. The social distancing, still maintaining that 6 feet the best that we can is imperative. The other thing about face shields, and I'd say that in the hospital settings, we use eye protection, especially in situations where there's going to be aerosolization. So if a patient, for example, is getting a nebulizer, or if a patient were to have a procedure done on their airways that would be aerosolizing saliva, then that face shield would help protect the skin and the surfaces. So that's the bottom line here with face shields. So my 2 cents on that is that masks with face shields would be better. If there is some reason that masks can't be worn, and there's not a very long list there, face shields is better than nothing. Your other question, Chelsea, was about thresholds, and we've gotten a lot of questions about thresholds, and here's the challenge with a threshold. There is, let's just say we're going to come up with a percentage, a percentage of positive cases in a classroom. And let's just say we're going to put it at 10%. And if that number hits 10%, then that classroom is done, decision made, we're moving on. Well, there's a couple problems with that. Number one is 10%, we got 30 folks in a class, let's say. So that's 3 students. Let's say student 1 comes with a positive case, and then we see a student 2 weeks later with a positive case, and then 3 weeks later we see another case. There's 3 cases over a period of 6 weeks, and that's your 10%. So does that class need to be shut down? I don't think that classroom needs to be shut down. We're going to expect to see some cases here and there, but that's your 10%. So these percentages are a challenge. What's really important is to know what is the concentration in that class of active COVID. And so at the end of the day, these are going to be made in collaboration. What's most important right now is the relationships that we've already established and are going to continue to establish with our school nurses, with our school administrators, with our sports trainers, to ensure that we know the situation in the school. To that point, we're putting together a standardized process in which there is a case, and then that case gets communicated to us in real time so that we can see what's happening, so that we can be the support mechanism to help make these determinations. But it's not just about what's going on in the school, also what's going on in the community, what's going on in the hospitals, what's going on with our positivity rates. So many variables here, which is why you're not seeing these thresholds widely either used or published, or there are just so many variables here that we're going to need to take and use appropriately. And that's what we've been doing for 5 months. And so we're going to continue to do that with schools. What's most important is that we're communicating, and I've been very pleased with those communication channels already before schools even started. So thank you, Chelsea. And on to KAGS.
Hey, Dr. Sullivan. It's Gabriella.
Hey, Gabriella.
Hi. So I was just wondering, looking at the numbers, the Hispanic population in the county and in several areas across Texas, they're facing like a really high percentage of COVID-19 cases. So I was wondering if you could speak to why that's happening and maybe a possible solution that might be in mind.
Yeah, so Gabriella's asking a tough question, and one about our Hispanic population that has been, you're exactly right. Throughout this, for months we've been seeing this and talking about how it's COVID disproportionately affecting our Hispanic population. I think there are several things at play here. One is that many in our Hispanic community have continued to work as essential workers without that luxury to stay home and work from a computer. And so that's a reality that I think has hit the Hispanic community. Number two is that when we just look at by populations, the density of individuals in one home, that is a challenge, more of a challenge in the Hispanic community than other communities. And what I mean by that is that we know that if we have a bunch of folks in one room or living in one area, where we have more folks living in an area, perhaps multi-generational as well, which is more common in the Hispanic community, that we can see more in that home be affected. We've seen that. We've also, interestingly, with our and the beauty, one of the many beauties of the Hispanic community is its gregariousness. And so earlier on, we saw the gatherings that were happening as well. That's happened, of course, in all of our demographics, but and we have seen that certainly improve. But that was definitely a factor in the summer. We saw that in several cases and several clusters here at the health district. And so, at the end of the day, and the other thing that's we have to keep in mind here is access to healthcare, access to testing. And we have known for years that there is an unfortunate but real disparity in access to healthcare. among our Hispanic population compared to our Caucasian population, for example. That's a reality that's well documented and well published. And that there's no doubt about it that comes into play here too. So I think there's many facets here. What's important is that you're all helping us get that word out about the Hispanic population being impacted by this. And the other thing, Gabriella, that we're also learning that is another dimension here that I'm sure we'll learn more about, but our genetic predispositions and the comorbidities. We also know, and again, getting back to access to health care and these things are higher risks of diabetes, for example, or of obesity. And these are things that we also need to watch as comorbidities for really for all of our populations. But where we don't have access to health care, those comorbidities are at higher risk. And so this is part of a bigger trend and problem, and something that we've seen nationally as well. So there's a lot of literature out there about this, asking the same question that you are, Gabriella, about why this is the case and what we can be doing about it. And so I think that what we can do today is get that message out about how important this is, about maintaining that social distancing, wearing masks where we can, and doing the very best we can with our current situation. All right, and on to WTAW.
Thank you, Dr. Sullivan. Bill Oliver here.
Yeah, hey, Bill.
Two things. A coworker has heard, and I'd like to have confirmation, if the state has been sending rapid COVID testing kits to Brazos County and other places where positive cases have been higher than average, and if that's true, if there will be more rapid testing kits coming now that the numbers are dropping. That would be the first question. Second one, an observation, the hospital bed and ICU bed rate percentages remain high, but the number of Brazos County residents who are hospitalized has fallen under 20 much of this week. And I'm curious how all that might compare to before the pandemic or even a year ago at this time.
Mm-hmm. Yeah, thank you for those two questions, Bill. And so, Bill's first question is in surrounding rapid tests. And I'm not sure if they're talking about the test materials or the entire test, the entire test kit. But what I can say is that here we can make what they call star requests for testing materials, which was the big rate limiter, one of our big rate limiters several months ago. And we did get a shipment in of materials to distribute to help with testing kits. All right, this would be the swab and the media that we put the swab into to then be sent off to be analyzed. And so we did. I
think that's what the coworker is referring to.
And so we did get a shipment of that in, and so in response to the second part of your question there, that was based on what is called a star request, and the state looks at these star requests and based on needs will deploy the resources to where they're most needed. So I wouldn't say that just because our positivity rates are decreasing that we would be dropped out of that consideration. Really, it would be how are we doing relative to other requesters on these star requests might be the best way of framing that answer. And with respect to the second part of your question, Bill, was about our ICU bed rates, and really I think our bed rates in general, and it's a good question about where are we running in general. And it's interesting. Hospitals are pretty, if you will, lean places, and so they operate very efficiently, and so they try to they do a good job of forecasting. Hey, here's where we are, and so we have enough staff to cover that need, and we're not going to have a bunch of excess beds if we don't need them, because that would be unnecessary. And so hospitals do run relatively higher occupancy rates, and so it might be 65% on a given day anyway before COVID, and those rates of course vary, and we saw many times before COVID-19 where we would be on divert, either meaning that we can't take in more patients because of for some reason, and the cycle of patients getting ill perhaps flu season, et cetera. Winter months, typically this will happen more often where the hospital beds are full. So the variation that we've been paying attention to, I think what's more important than the number on a given day is the trend. And when I look at these reports, that's what I'm looking at. I'm looking for a trend. You know, are we consistently, for example, hitting these 80s, 90s, and pushing that way? And that's what all of our hospital administrators and chief medical officers are looking at on a daily basis as well, and making determinations as needed, you know, thereafter. Yeah, go ahead.
As a follow-up to that, then, you had mentioned earlier in the pandemic about the reluctance of some people to go to the hospital. Now that we're further along in this, would the higher hospital bed rates reflect patients being more confident in getting those procedures done, not waiting so long to get things done?
I think that's an interesting hypothesis, Bill, and that's very possible. I don't have that data, and I don't know that we do right now. There is no doubt that, especially we'll go back to, I would say, May timeframe, maybe into June, where we were definitely seeing an increase, if you will, backlog or of individuals who had delayed care who needed to come in. No doubt about it. I get the sense that we work through a lot of that, but what you're asking is an interesting hypothesis, and that is quite possible that that's the case. But I don't think that, you know, when I speak with our hospital administrators and chief medical officers, that there's a concern, or that they are, you know, in any way, you know, anxious or panicked at all. I think that they're doing their job every day to maintain occupancy, and they're monitoring the situation as they have been for 5 months. And they're a part of our regular calls that we continue to do with our elected officials and with those who are interested in knowing what's going on in the community, to ensure that we're safely monitoring our hospitals. And so that we continue to do that, and I think they've done a fantastic job of that. And you know, one of the kind of as a follow-up to your point there, and the concern about occupancies is, we think about the surge, you know, that we went through 6 weeks ago with the cases, 250 a day, you know, 300 a day. Sometimes we were seeing, right, these big numbers, and that happened day after day after day. And all of us were very concerned. How is that going to translate into the hospitals, to our hospital occupancy, and to deaths? And I think for a lot of reasons, we did not see near the impact that we thought we were going to see. We definitely saw our hospitals busier, and unfortunately, we've had some fatalities, as we talked about today. But you know, it's impressive that things have been able to work out the way that they have. And I think that there's a lot of theories about why that's the case, but at the end of the day, that's really important, because we do expect in these coming weeks and coming couple months to get back to numbers like that, back to numbers like we were seeing 6 weeks ago, 250 a day, 300 a day. I think that's very possible. I think we need to brace for that possibility. Now, granted, we were not wearing masks very well back then, and there was a lot of socialization going on that I hope has stopped. So, you know, really, it's yet to be seen, though, of course. So thank you for those questions, Bill.
Thank you very much.
Yeah, absolutely. And on to KRHD.
Hi, Dr. Sullivan. It's Hallie.
Yeah, hey, Hallie.
How are you?
I'm doing great, thanks.
Yeah, so 2 questions. I'll kind of start with more on the school side. We've heard teachers preparing wills, raising their life insurance. A lot of teachers are worried. What advice do you have to teachers that are worried about themselves staying healthy, keeping their students healthy, aside from the washing your hands, not touching your face, wearing a face mask, but what other advice do you have to those individuals who are very worried about going back to school? And then secondly, on a different topic, HHSC is allowing limited visitation to nursing homes, and I do know that the nursing homes here in the Brazos Valley, there's not one that is going to be receiving a point-of-care device to fast-track their testing. And so with this visitation, would you suggest nursing homes here in Brazos County to open up to limited visitors, or what is just your recommendations in regard to that new limited visitation?
Okay, thank you for both those questions, both good questions. And number one, is anxiety around returning to school. Teachers and maybe parents as well, and some children in returning to schools. And what I would say is that, this COVID-19 is of course there. We all know about it. We've been talking about it for 5 months. But we also have to remember that we, for example, those in the healthcare world have been taking care of COVID positive patients for 5 months. And there was a time that there was a lot of anxiety in the healthcare world about what this is gonna look like in returning to care for patients with COVID-19. Now, there's two things that are different here, and I'll acknowledge those clearly, right? I mean, this is a patient with COVID-19, so there's a lot of aerosolization going on from the patient. We know that patient has COVID, and so there's PPE that's being worn. But we're not wearing N95 masks and a full-out spacesuit for our usual encounters with patients who we know have COVID-19. And so we have to keep that in mind, that there's all the folks who have been testing for this. We think about the testing in clinics, and that has been going on for 5 months, 6 months, longer really, if you look at the U.S. and the world experience. So we know a lot more about this virus than we did back then. And what we know is that masks work. We know that distancing works. We know that hand hygiene works. We know that our schools are putting together plans to mitigate risk. And so we have to review those plans, and we have to be comfortable with those plans, and we have to ask questions where we have questions about that. That's good dialogue. And from those questions we learn things, and from those questions we can get better. And so my advice would be to review those plans, to review the guidance that's out there, and to be reassured that we've been doing this for a while. But I would also say that especially as far as getting wills and life insurance and all of this, I wouldn't panic. I don't think that there's any need for that at all. But some of us have anxiety around that, and we acknowledge that if that's the case, and we acknowledge that. And so if there is still, after all of that, a lot of anxiety, I think that we would take that up with our supervisor and say, hey, here are the concerns I'm having, and to enter into that dialogue. Because what's key about COVID-19 in these past 5 months is that we learn something every day with respect to the next step. And so we're opening up schools, and that has a lot of folks with a lot of questions and a lot of anxiety. And I can assure you that the superintendents and the administrators, man, have they been working, and they have put together good plans. They've been in constant dialogue with TEA and with us about the best ways of doing this, and remain open-minded about the way that we do this moving forward, and malleable and flexible about the way that we do this. And so, maybe a teacher had a lot of anxiety could reach out to one of his or her friends who's a nurse and ask, hey, how do you feel about this? You're doing this every day in the healthcare world, or other healthcare workers perhaps, and to engage the community about it, I think is what my advice would be. You asked a question about nursing home visitations, and this is important. It's important. We have think about since really March, February, in some circumstances where we've had no visitations for our lonely and often lonely and isolated elderly. And so I commend those who are working on getting visitation done safely. And again, this is the theme with COVID-19, right? We have to do things safely, things that are important. And it is important that we get visitation to our elderly members in our community. And so, as you mentioned, point-of-care testing devices and outdoor visitation, which is something I've seen also. So ways of doing that make sense and that mitigate that risk. And so I commend those efforts, and I think that we should try to look at the whole here and do the best that we can to mitigate that risk. And so I wouldn't, directly recommend for all of our long-term care facilities to do a point of care testing as a requisite for this. What I would do is, as we have been doing, is collaborate with them with their circumstances and say, how could visitation look under this guidance at your facility? And as you've seen, that theme is it's very molded to the current situation, the situation of the requester. And so those discussions have continued with our long-term care facility partners as with our schools. And so you see the theme here that we need to do the very best we can to do essential businesses and to do essential work and teaching and education to do it safely. And as is the case here with visitation with our elderly community members. All right, and on to KBTX.
Hello, Dr. Sullivan. This is Kendall. How are you?
Yeah, hey Kendall, doing all right, thank you.
Good to hear. So my first question has to do with our healthcare system in terms of, do you think that our healthcare system is prepared for, tens of thousands of A&M students to descend on the Brazos Valley and what that kind of looks like? And then my second question, I know you guys have consistently been in contact with our local school districts and kind of talking with them about figuring out good ways to start the school year this year. My big question is, what are some of the specifics you guys have kind of talked about beyond just face masks? If there's conversations about, plexiglass separations, smaller class sizes, anything like that to kind of mitigate any sort of spread that could happen in our local public schools and private schools.
Wonderful, thank you, Kendall. So question number one is with respect to my confidence in our healthcare system's ability to take on students, to take on the population. What I would say is yes, I am confident. And what I'm confident in is our community, and I'm confident in the way that we've been collaborating for 5 months. We all know this risk. We also know that this institution of higher learning that benefits our entire community is important for lots and lots of reasons. And we also know that when we had, and by the way, the estimates that I've heard is as many as 30,000 students have been in town this entire summer, which what I understand is more than double what would typically be. And so when we think about that, we say, well, we've been dealing with this for the summer. And when we saw that face masks became more widely used, and we saw the response to what was happening to the surge, we saw numbers impressively decrease. And so that is going to be what we're going to need to do moving forward. Texas A&M has been a wonderful community partner through this, have been so engaged with us at the health district and remain engaged and have good plans that we've looked at, reviewed, with respect to how are we going to address the inevitable increase in cases. We expect that. How are we going to trace the contacts? How are we going to identify the cases? And that's all been part of this consortium that we talked about several months ago that we've been working on, that is set up at Highway 47 to do these cases. And so I have confidence in us as a community. Your question was about the hospitals or the healthcare system in general, but all of us are working together, and we think about upstream prevention really of what ends up in the hospitals. And that upstream communication and collaboration, I think, has been outstanding, and we'll continue to do that throughout the fall. And I have a tremendous amount of confidence in our hospital systems, and again, that collaboration and their planning and their day-to-day decision making that again, for 5 months that they've been doing. They're no stranger to COVID, and so I think we can all have confidence in that. Nobody can predict the future, and we're going to be working collaboration, but it's not, things don't happen overnight. We have metrics in place. We have collaboration, communication in place, and so we can see things that are happening and make decisions as we need to make decisions. That's what's most important. as we move into uncertain times. Your second question was with respect to some of the discussions that we've been having with the schools, and I wrote down here plexiglass. I know you mentioned that as mitigating factors, and that's an example. So I know some schools are going to have plexiglass around areas that they don't have the confidence that the kids will have their masks on or are unable to cooperate with masks. And as we talked about with face shields, right? Face shield is a mitigator. You know, I think the best mitigator is a face mask. The evidence is pretty clear on that. But a face shield would be the next best thing. And so, what are the things that we can do within the context that best mitigate COVID-19? And we think about a kindergarten classroom to a high school classroom, and there's a lot of variation there in the behavior and activity of the students. And we're also learning there might be a decrease in the risk as well from the studies that are coming out with respect to their risk to the community. So we take all of this into account, and we continue to review the plans that are there. It would be exhaustive to go through all of the things that we talk about, and I think that what's important for our purposes here is that the big concepts around wearing face masks and around socially distancing and how can we do that in a school setting. Lots of creative and innovative and sharing practices among school districts and sharing practices among health districts about the best ways that we can approach this. And so there, we mentioned the block system. We mentioned one-way trafficking through. We mentioned students staying put where teachers rotate. You mentioned plexiglass. We mentioned the masks. We mentioned face shields on top of that. You know, for those who will be wearing those. So all of these mitigating factors and how those come into play for our students are all being done. And so these. Again, I remain grateful to our schools who have been so collaborative in this process, and those collaborations will continue, obviously, as we move forward to the opening of the schools here in about a couple weeks, 10 days. So there it was. There were the cases, or rather all the questions. And Sherry, wonderful work. Thank you. Again, just you and I rolling solo today. I appreciate it. I'm sure everyone did that as well. We got done, and so we will be, these press conferences. We're going to do these as we feel needed. We appreciate the comments and the questions and the concerns that come in. Those help us know what you need to know, what you want to know, and that's what we're here for. And again, thank you to Sarah Mendez for putting all this together today. And we will be ready for the next one. And thank you all so much, and have a wonderful afternoon.